Secretary Burwell, great to be with you. So we're toward the end of an administration. You've served for many years in this administration. You're working on big, important issues, maybe the biggest and most important issue to President Obama. As we're nearing the end of his 8th year, what do you think will sustain? What will be a lasting legacy of this term of office?
So I actually think there will be a number of things, but certainly I'll speak to two. And one, I think everyone would expect me to say, which is the Affordable Care Act. And in terms of the lasting legacy there, I think it will be about the three things that the Act was fundamentally about. And one was access, affordability, and quality. And at the time at which the Act was passed, and I think it's important to reflect that as a nation, there actually is consensus that we needed to do better on all three of those things. And if we think about where we were with regard to the issue of access, before the Affordable Care Act, 1 in 7 Americans were not insured. And now we have the lowest uninsured rate that we've ever had as a nation, and 20 million more people have access to health insurance. With regard to the issues of quality, in terms of where we were before, the question of what we were paying and the value we were getting as a nation was a very important question. And some of the changes in quality I would highlight are the fact that I think probably everyone in this audience knows someone that has cancer, or has had cancer, or asthma, or any pre-existing condition. And no longer as a nation, if you make a transition, do you need to worry that you or your family will be kept out of health care because of a pre-existing condition? And that's a fundamental change in quality. There are also changes in quality that I think many people don't know or recognize. We've had a reduction in readmissions, hundreds of thousands of fewer readmissions into hospitals, using the tools of the Affordable Care Act to create both carrots and sticks for providers to reduce the number of times that someone goes in the hospital but has to come back in. So that's quality. In terms of access, we talked about that, and finally affordability, in terms of what will be the sustaining part of it. While progress needs to continue to be made, in terms of the issue of affordability, when we think about the 150 million people who have employer-based insurance in our country, and that's what the majority of people have in our country, and for those people, it was just announced last week that now, out of the last 6 years, we have had 5 of the slowest growth years in premium growth. In addition, with regard to affordability, when we think about the taxpayer, in terms of what Medicare spending was supposed to be and what Medicare spending has been since the Affordable Care Act, we've saved $473 billion. That's with a B, dollars as a nation. And so I think that that will be lasting. The other one I'll just mention briefly, it's part of why I'm up here as part of the United Nations General Assembly efforts, is the importance of global health security and the progress we've made as a nation in terms of preparedness for things like Ebola or Zika. And I will not go on in terms of a lot of details, just say the preparedness right now as a nation. Before, there were only 3 centers that could handle patients with Ebola in terms of where we were referring. There are 9 spread out across the country. In addition to that, in every state and every region of the country, there's now a place that can start the intake of care and then transfer them to a place. We also have tested the public health system. There were over 30,000 people that were tracked by local public health systems when they came into our country to make sure during that 21-day period when they came in that they did not. Their temperatures were taken and we were assured, tracked so that they didn't have Ebola. So I would just mention that that is very important because I think we're going to see more and more challenges to our public health system.
That is certainly one of the great accomplishments after an incredibly terrifying for many people around the world, particularly in the United States and Europe, when the disease started spreading. You all put an enormous amount of work into containing it. As you think about that issue, or as you think about the core healthcare issues, are there ongoing efforts that you still don't feel are done, that between now and the 3 months and however many days until you're finished that you feel you really need to lock down so that the next administration can carry them forward?
3 months and 30 days, to be exact. But in terms of the question of the continuation, I would highlight the affordability and quality issues in the healthcare space, because while I highlighted where we've gone from to, as we think about the future, this is the place where we are in the middle of a fundamental transformation, and it is necessary. For those of you who are in the private sector, the question of healthcare cost, and I was at the Office of Management and Budget before, and I was in the private sector as well. For either, this affordability and quality issue is essential from a public perspective or from a private sector. And while we've made some progress, it's the place where I have been very focused since I've gone to HHS that we need to make more. And we'll continue making that progress as we end this administration. And then it's something that I believe the next administration, whoever it is, needs to focus on deeply. What does it mean? Right now, our healthcare system, this is a highly educated audience. If I asked each of you to please write down your premium, your deductible, and your copay. I see smiles, and I won't ask you to do it. The reason I asked the question or raised this point is because in a true market, you would have some idea. The question is getting our system to function as a market, where there are consumers, a consumer at the center, there's an understood product, and there's value. And that's where we need to move, is the consumer at the center of our healthcare system. And how do we go about doing that? 3 fundamental changes. First, we have to change the way we pay. Right now, we pay for transactions. We pay for services. We don't pay for outcomes. And so we have to move from a system that pays for quantity to a system that pays for quality. Number 2, and you might ask, how do we go about doing that? Well, a very specific example. If you think about your mother going in for a hip replacement, and she goes in for the hip replacement, and the person comes to the house and says, put the dishes down, pick up all these rugs so when you come home, you'll be able to take care of yourself. The next person, they come in, the anesthesiologist, the surgeon, the physical therapist. In the world we operate in today, in many places, they are paid individually, piece by piece. You get a bill for this, you get a bill for that. What we've done is, through the authorities we've been given in the Affordable Care Act, we will be having what we call mandatory bundles, which means that group of people will be paid together for an outcome, for the quality of your mother's hip replacement. So it is in the interest of the anesthesiologist to make sure that the physical therapist is doing their role and that they're working together to do it. And so paying differently, paying for an outcome. The second thing we need to change is actually how we deliver our care. And that's 2 things. Coordinated care, and you can understand how that new payment system forces the coordination of those different players. And the second part of that is prevention, and a focus on prevention and wellness. How does that occur? What does that mean? Well, first of all, in the Affordable Care Act, for everybody, whether you're in the marketplace or not, many prevention services do not need a copay. But the second thing is we've been able to model with authorities the idea that you can, we took diabetes, we worked with the YMCA. They have a prevention program for Medicare-eligible people who are pre-diabetic. In 15 months, average body weight loss 5%, average savings $2,600. And that's because you're working with the Y. There's a place for them to come, they exercise, they're challenged by each other, it's a social thing, and it's a very different approach, but it's about prevention. Third element of this is data, and making sure that we unlock data for the consumer and for other providers. That means being able to use your healthcare information to help you make decisions, choices, and be an engaged consumer.
And I was struck in listening to all 3 of those that there's, the theme of Concordia and of this conference, as all of them have been public-private partnerships. And there's a role for the private sector and the public sector. Across those 3, are there particular instances where the private partners that the government deals with have acted in a far-sighted, public-spirited way, maybe even beyond, maybe that surprised you or went beyond what you would expect?
I think certainly in all of those areas, in the idea of the payment change, there are leaders in the private sectors in terms of companies that are already leading and thinking about things in that way. The company I used to work for, Walmart, in terms of how they think about their health plans and payments for certain types of surgery. They have found the players that are providing those services, and that's where they send you to do certain types of surgery. So there are great players that are happening. The insurers are actually participating in changing the payment system and how they create their relationship with the doctors and hospitals. The providers, there are great examples. Montefiore, up the way here in New York, is a terrific example of that coordinated care. Go visit, see how they have coordinated care among their providers, including behavioral health right there on spot, especially when you're talking about children and services. And so across the board, I get the opportunity to see in any of those examples, there are private sector players doing incredible work. And the YMCA, whether it's in Cleveland or Washington, D.C., they're the people who tried this out and showed that this could work.
Okay, we have a new president coming in, either Mr. President or Ms. President. You've been there for a presidential first year before. It's where we first met. I won't tell them how long ago that was. As you think about presidential first years, they're great opportunities. The Affordable Care Act was passed in a first year, as were a number of other major Obama legislations. No Child Left Behind in the Bush administration. The new president coming in, what are some of the things that you think he or she should think about, either on a policy dimension, on a process dimension, or thinking about public-private, the role of the public-private sector, the role of citizen organizations? How do you think through that first year in the Oval Office?
So I think, and first of all, I won't comment on any candidates or anything, the Hatch Act. I will speak only to the issue of the question of policy priorities as you come in, and also process priorities. And I would just highlight a couple of things. One needs to continue this very important work that is actually bipartisan. When I talked about that changing the healthcare system, the support for that is bipartisan. And much work has been done. There was legislation that was passed last year in a bipartisan fashion that continues this effort and this work. And I think this is so fundamental and so important to the health of our economy and the health of our citizens that to me that continuation of moving us through to a different place. Right now we have two payment systems because we're trying to transition, and that's hard. So the sooner that we can get to the other side of that, the sooner that we have better measurements for quality. And so that's a policy place that I believe is a real priority and a real opportunity for any new president. The second thing that I would just say to any new president, and having had the honor and the opportunity to serve twice, but also to be in other roles, is just that real importance of getting high quality people into place quickly, because all the great policy in the world goes nowhere without execution. And so having that capability, and at a place like HHS is a $1.1 trillion budget. If we were a country, we'd be the 17th largest in the world. And so spending that money and getting the results from that, that's an execution. It's a strategy. You need the right strategies. But you clearly, from the Food and Drug Administration, the Center for Disease Control and Prevention, the Center for Medicare and Medicaid Services, the National Institutes of Health, that's only 4 of my 10 operating divisions. You've got to have execution capability. So any new president, I would encourage to focus on that issue of having high quality people in place.
Before this position, you were the director of the Office of Management and Budget. How important is that first budget? And in the next president's first year, when they're wrestling with big budget issues, particularly under the consequence of sequestration and the difficulty of passing budgets in the Congress, what are some of the big challenges the president will face, and where would you steer him or her?
I think a number of things about the first budget. You know, a budget in any organization is a reflection of your values. That's what a budget is. It is the translation of your priorities, and making sure that that translation of your priorities occurs. And so I think it is important to make sure that as you put that budget together, that you are reflecting the priorities that you want to focus on in an administration, number one. Number two, I think the first one is important, and it's important to set the tone of how you will have those priorities and how you will value them. And the third thing that I think is important, because this is a place with particular interaction with Congress. It's a place that's a real opportunity to set the tone and tenor of that relationship as well, even though one knows there will be disagreements. But how you go about thinking about, handling, articulating, and dealing with those conflicts, I think is an important thing.
One last question. This is a historic election by many different standards. It's historic in the sense that we have a major party candidate, for the first time, a woman major party candidate. It's historic in the first time we have somebody who comes purely out of the business world with no previous public sector experience. I'm curious, since you've served on the governing council of the Miller Center, we're an organization devoted to history. Concordia asked us to use historical perspective in this meeting. What has history taught you? How do you think in time? That's one of the great chapters or great titles of a book on the presidency, is Thinking in Time. Give us a little bit of your own thought process as a senior government leader across a number of agencies and in the nonprofit sector. Tell us a little bit about how you think about history.
I think it offers us a number of different things, and they're interrelated. They're not mutually exclusive. It offers us learnings, actually specific learnings about tactical things as well as strategic things. I think it teaches us about context. I think when one looks at history and you're in the middle of the decision making, it really does help you with the third thing, which is prioritization, by giving you context. What is remembered? What is most important? Every day when you're in government, there are so many things coming across your desk. And I think history is an important tool to help you pull the lens back and make sure you're focusing on those which will have the most important impact, and that thereby helps you with that prioritization.
Great. Do we have questions from the audience that people might want to ask Secretary Burwell? Because I could keep going.
Yes, I have one. I'm curious about the idea of incentivizing. Hi, how's it going? By the way, fellow UVA grad here, so appreciate you being here. I'm curious about the topic of incentivizing outcomes, I guess, like you were talking about in the Affordable Care Act. Just to clarify, does that mean that are you grading on like the quality of the care, like if a surgery is successful, like that kind of thing? I just wanted to get a better sense of what that actually meant. Thank you.
So when one measures quality, and it is a more difficult thing in the healthcare space than measuring affordability, but absolutely, in terms of that hip replacement, there are any number of measures that you use to measure the quality in terms of the person's mobility, in terms of their recovery time, in terms of the question of if they have to come back in. So there are a set of measures that have been developed, and these have been tested and developed both by the private sector, to your point, as well as our own pilots that we've done to try and get to the right combination of measures that measure actual quality of the outcome of a hip and knee replacement. And what's interesting is in the United States, price varies very widely in the United States where you get a hip replacement. And the other thing that varies is the quality in terms of those outcomes of how much mobility you would have or how long it will take you to recover.
Thank you.
Burwell, could you address behavioral health, mental health, because you were mentioning knees and hips, and those are a little bit easier than what we see in behavioral health, where we see very little focus on outcomes and quality. So much harder because many of the providers, there's such shortages. So maybe could you just say a few words about where you see the future going in behavioral health, given how many Americans buy it?
So behavioral health is, I think, one of our more challenging issues, both in terms of quality measurement, but just even in terms of recognition and the conversation about behavioral health. The marketplace takes important steps forward and requires coverage for behavioral health. The Mental Health Equity Act also requires that it is treated the same, but getting to that stage of where that actually happens is a real challenge, and that's part of why coordinated care is so important, and that the recognition that behavioral care shouldn't be considered any differently than other types of care that we receive for our health. And so it has a double challenge. There are other conditions where quality is hard to measure, but are considered the same as a knee and a hip. Behavioral health, I think, has the additional challenge of its acceptance. And so it's something we're continually working on and talking about a lot to make sure people understand it is the same and should be treated as such in terms of people and their health care.
Want to thank you for all that you're trying to do to improve healthcare in this country. It's a massive undertaking. It's a contradiction when healthcare is so centralized and the business of healthcare has become so big, yet the innovation that we need is going to come from the small startup and the outside-the-box thinker. And so there was a panel yesterday on cancer and how that's all done, but I represent a small company that's trying to do business with HHS. It's a very difficult task when we don't have the army of lobbyists or the resources to get the attention of the people on your staff. So how do you recommend and suggest that companies that are making the investment and taking the risk and have the innovation, how do we have the opportunity to showcase that to you?
So I think it's a place where we continue to work and try and focus. One of the big things that I've emphasized at the department is the issue of the consumer and the consumer at the center, whether that's the care or when we're dealing and working with, in a sense like this, small businesses that are providing innovation, we should consider them consumers too. And it's hard in a department that is as large and trying to do as much. But some of the places, I don't know if your company is a high-tech company, but one of the places where we focus specifically on this is in the technology realm, and our Data Palooza that we hold annually every year, where companies come from across the country and actually the world, so that we are encouraging that kind of innovation. And we're doing it in bits. So today we have announced that the FDA actually is doing a challenge where we'll do an award of $40,000 for an app that will help people understand how to access naloxone. And naloxone is the drug, the life-saving drug if someone has done an opioid overdose, either heroin or a prescribed opioid. And so that's a specific effort. You may know about our effort. We actually put out a call and a challenge for an understandable health bill. And so, we're trying to use tools like that, and also trying to work in terms of attitude for listening, using technology, hearing voices when we are doing our rulemaking, trying to do that more broadly than we have done before, and focus on the small. Being from a rural place in America, I'm from West Virginia, it's something I emphasize and focus on. It's hard to do, so it's a place where we can improve, but those are some of the doors, and that may not fit exactly with your company, though.
Other questions or comments? I think we have time for one more, and if someone doesn't ask it, I will. Oh, okay.
I very much enjoyed what you were saying, but from where I come from, healthcare is also, the cost of healthcare is growing rapidly, but it's a lot less than the United States. I come from Australia. In a previous session, there was bipartisan support for reducing the cost of government and particularly the cost of healthcare. Where would you see reduction of costs of healthcare, not the cost of premiums, but the cost of healthcare occurring, and what would you advise an incoming president about?
So we have had some of the slowest price growth in the United States and overall healthcare cost growth that we have seen on a per capita basis. And that is one outcome that we have, but I think I reflected what I think is important is we need to move to the next stage. And a part of that is changing the fundamentals of the payment system. Because when you don't have a market, as I was describing, that's a part of what doesn't put downward pressure on price as we go. So some of the fundamental changes that I think we need to make are in the payment system. I think the other place that we need to do or use market tools. For instance, we have asked for the authority, and I think in Australia, your government has it. We've only asked for it that we could negotiate on high cost and specialty drugs. So I came from Walmart, In terms of negotiating with your supplier, like, that feels very natural to me, that that's actually what you do to serve your customer or your consumer. And so those are some of the types of things, to be specific, when we talk about payment and that sort of thing, that we think will put downward pressure. If we can negotiate on, and it's a small band, not all drugs, just the high cost and the specialty ones that seem to be going. And so that's a specific example of something that I think, if we had those authorities, I'd love to have that authority right now in terms of what I've seen in terms of costs over the years, and one of the big major drivers that we see now, and we're going to see even more drive overall healthcare costs in the U.S.
Well, on behalf of Concordia and the Miller Center, thanks to Secretary Burwell, one of the most dedicated, hardworking, effective, brilliant public service in America today.
Kind. Thank you all, and thanks for having me and being interested. Thank you. Thank you.